We're for sharing innovative treatments and preventing disease before it ever develops. Learn how our team is working to better care for you on this edition of UVA Health System Radio. Here's Melanie Cole.
While most people associate tumors with cancer, they can also be caused by genetic factors. And today we're talking about neurocutaneous disorders and their treatment options. My guest is Dr. Ashok Asthagiri. He's a neurosurgeon at UVA Health System, where he leads a multidisciplinary team in treating neurocutaneous disorders. Welcome to the show. So tell the listeners, for people who aren't familiar, what are neurocutaneous disorders?
Great. So neurocutaneous disorders are a constellation of different disorders that have been grouped together because of certain components that are very similar. So folks with any type of neurocutaneous disorder will have neurologic problems, that's where the neuro part comes, and oftentimes also have cutaneous signs or skin alterations that can be readily apparent on physical examination. And so that's how these group of disorders have been sort of clustered together. In addition to that, this group of disorders also carries what you had mentioned earlier, a genetic component, that we understand that many of them are actually caused by known mutations in DNA and can be inherited from parent to child. And so, we've lumped all these together because they sort of fall under the same category of common symptoms that may cluster together, and that's why they've been historically grouped together.
So, do we know what causes them, or how common are they really?
Well, the reason that we're still talking about neurocutaneous disorders and that it's not widespread knowledge what they are is because of their relative rarity. They happen in about, if you cluster them all together as a group, they occur in about 1 in every 1,000 persons living in the United States. When we think about that, that's a pretty small number. In fact, they're actually covered under the terminology of rare disease by the Office of Rare Diseases in the National Institutes of Health. Having said that, that's also what has propelled them sort of to the forefront of research and investigation, and actually has really gone into why we are able to definitively say what causes these types of syndromes. And the mainstay of what causes them are genetic mutations. And so, for example, there are several of them that are quite common. These are the neurofibromatosis, von Hippel-Lindau syndrome, and tuberous sclerosis. And we know the genes that are involved that actually cause these, and we can actually do genetic testing to identify whether these genetic mutations are present.
Now, if somebody does have these genetic mutations, are there certain treatments? Is this something that is a chronic situation in their lives? Tell us about treatments.
Yeah, even though it is oftentimes passed from parent to child, it is not just a pediatric disorder that folks grow out of. It's, as you mentioned, a chronic condition, a lifelong condition. And for many of the syndromes, the adult aspect is equally, if not more important, to their chronic care as their pediatric years are. And so it's really a lifelong process of continual surveillance and treatment that's really needed in order to manage patients with these types of disorders effectively. So as research and investigation into these disorders have developed, the treatments have been really ratified over the last 20 years. So let me give you a few examples of how things have changed. And I think it sort of epitomizes what medicine is evolving to in many conditions. So 30, 40 years ago, what happened with all of these types of patients is you wait until you get a problem, you see the doctor, and we might identify a tumor in the nervous system that's causing the problem, and then it gets taken out. For some conditions now, we have actually developed certain types of alternative surgical therapies, and also the use of radiosurgery, which is focused radiation, to manage some of the tumors. In other situations, it's also progressed to very efficacious types of medical therapies that can absolutely control some of the symptoms that develop, such as hearing loss in some of the conditions, and also the tumors that are growing that can cause seizures. Some of very effective medications exist for that and are under clinical investigation in clinical trials. And so, it sort of epitomizes the transition from sort of a reactive type of treatment. When you have a problem, we take care of it. In general, medicine has evolved such that we're not trying to react to problems that develop, but rather be proactive. Be able to figure out problems before they come on, number one. And number two, try to treat them in a more holistic approach and try to treat things in a less sort of morbid, even less surgical approach. That's where things are moving to, and that's what we're trying to evolve to and create new treatments for them.
You're focusing more on preventing or maximizing the person's capabilities at home and in the community, correct?
Absolutely. Because folks with neurocutaneous disorders oftentimes develop multiple nervous system tumors. If you have, 3 brain tumors, 2 spinal tumors, and 1 or 2 tumors on the peripheral nerves, there's no way to sort of get rid of all of the tumors. We don't operate on all of the tumors just because they're there. Instead, we follow them very closely. And if they develop symptoms, naturally we would have to treat. But part of the issue is trying to figure out a way to optimize their ability to work and function in the community, and then also try to delay or prevent symptom evolution. That's where things are headed. That's where we would like to be in 10, 15, 20 years, and we're getting there. I think we're making our first steps into those type of advances.
And doctor, you lead a multidisciplinary team in treating neurocutaneous disorders. What does that mean, and why should patients come to UVA for their care?
Well, one of the reasons that I actually came back to the University of Virginia is because of this commitment to the multidisciplinary aspect of these patients' care. Patients with neurocutaneous disorders not only have problems with tumors in the nervous system and some skin changes, they also have, at times, cardiac abnormalities, endocrine tumors that can cause high blood pressure. They also can develop renal cell cancer and many other types of organ systems that can be involved. And so for each of the subtypes of neurocutaneous disorders, we've developed a multidisciplinary first point of contact team that has agreed to help manage patients with these specific types of conditions. For a long time, folks with neurocutaneous disorders would have to go to one center or one appointment to go see a neurosurgeon, and then 3 weeks later have a disjointed sort of appointment with another doctor who may not know about what the neurosurgeon said, wasn't very coordinated. And that's where
and
we're
now we
moving.
don't have much time. So what you're saying here, doctor, is that you can provide all of those different aspects in one place, yes?
That's right, yeah. That's what the University of Virginia has to offer for folks with neurocutaneous disorders. That's right.
Well, thank you so very much. You're listening to UVA Health System Radio. For more information, you can go to uvahealth.com. That's uvahealth.com. You've been listening to our discussion on neurocutaneous disorders and the multidisciplinary approach at University of Virginia Health System. This is Melanie Cole. Thanks so much for listening.